She's still working.
She retired. Hospital. Toledo was taken over somewhere. Changing. And so long. Changes. Administration came in.
Like I have dropped.
It's very. Experience around.
Okay, let's go ahead and get started. First item on the agenda is the call to order and roll call.
Here.
Here.
Here. Here. Okay, the next item is the adoption of the agenda. So any concerns, changes?
I will move to adopt the agenda.
Second.
So moved. The next item is the approval of minutes. Any questions or concerns with the minutes? No?
To accept as written.
Okay,
Second.
all right. All in favor?
Aye.
Aye.
All opposed? All right, next is board president announcements, and he's not here, so he doesn't get to have any. The next one is the health officer's presentation and report.
Hi, thanks everybody for being here tonight. I want to take the opportunity to introduce our new Director of Environmental Health, Brianna Breezy McCall. You want to stand up and wave? Also, I want to introduce our new Assistant Director of Nursing, Michelle Haluda. And our new school health liaison, Hope Eck. Thank you. I also want to give some good news that we received today, that we're going to be receiving 23,289 more HFI dollars in our fund. And the reason is some counties in Indiana opt out of HFI funds. And now's the time of the year when they reconcile the extra monies that have been set aside for those counties that have elected not to participate. So we are the recipient, we're going to be the recipient of $23,289 from the leftover funds. So that's great news for us. In terms of the health officer report, there's a few highlights I'd like to point out to you. On the lead testing, this month for the CHWs, for community outreach, the CHWs had a monthly record high of doing 104 lead tests. The previous high was earlier in the summer of 85. The year-to-date number of tests is 420, and that is more than we did all of last year in 2024. So we're going to be breaking last year's record. So we're really amping up. I'm really proud of the CHW team that are doing the lead testing in those preschools and getting in the door and getting, with the parents' permissions, getting the kids tested and getting those recorded, and the results are sent downstate. Medicaid does require that children under the age of 6 have at least 2 lead tests in their chart. So we're helping Medicaid reach their numbers as well. So we're really working on the lead testing, and going forward, we're going to be doing a deeper data drive and how to close some of the gaps in terms of those kids who need to get their levels rechecked because they're elevated, and also compliance in getting the kids tested, retested. That's been a barrier, and we're just trying to figure out how to address that. I also want to update the vital records. At the time the packet was put together, vital records for their statistics of live births, or total births rather. You'll see 2 asterisks for 24 and 25. And the total for year-to-date in 2025 is 3,386. And for year-to-date in 2024, it was 3,546. The gateway for the state website has been inaccessible for several days, and so we had to crunch our own numbers to try and figure those out, but those are the numbers for the report. Does anybody have any questions about the health officer report? I want to also point out, Ellen had asked a really good question in regards to the lead levels on the graph that is dated September 1st to September 30th. Remember, we're 2 months behind because the state, it takes them a couple months to get all the data into the computer. And so that's why we're looking at September numbers. Ellen had asked a good question about the unknown being 125 when everything else was 0. And the lab that we use will give, that the state uses, reports the number, and they put the letter B behind it for blood, and they don't say V for venous or C for capillary. And my understanding from talking to our director of environmental health is they've talked about this before, and it hasn't gone anywhere. Is that correct, Breezy? So that's why it's unknown. We just don't know if it's venous or capillary because they put B for blood. I don't know if they're missing the C and the V keys on their typewriter or what.
You mentioned that one of the challenges with getting the lead testing is to do the follow-up, the second test, correct? Or-
Correct. That's one of the many challenges, yes.
And because I guess I wonder if could you use this as an opportunity to give us a very basic reminder of when somebody gets an initial test, both what is that reads high, what you do next, and then also what sort of treatment is it? Because I can't remember if is it medication, or is it just like lifestyle diet changes? I know there's home remediation that will be encouraged, but
I think our new director is going to tell you about it because that's actually her area of expertise.
okay, good.
Yeah, so essentially whenever we receive an elevated level, the order of events is that the provider that collected that test or ordered that test and then received the result, they'll send it to the state. Oftentimes they will send it to us as well. Those that are familiar with our process know they can update us, but typically it goes to the state notifies us. The doctor will typically tell the patient's parents that they have to be retested within, I want to say 6 weeks. Sometimes it can be longer depending on the level. So if it's like above 10, I believe it's within 6 weeks. Is that right, Renata? I don't remember. But anyway, otherwise it's within 3 months. When we want the confirmatory test, it has to be, I think sometimes between 2 weeks, but there's different merits between our based on what the level was when the draw was completed. But once that's been done, we open a case that is assigned to an environmental health specialist and either a community health worker or a public health nurse. There's no medication unless it were to be extremely high. So sometimes there's a chart that says based on the level what the treatment would be, and it's pretty much usually just diet, behavioral changes like touching and putting hands to mouth, cleaning, stuff like that, addressing what would have been positive in the home for lead. The only time you would see any type of like medication or chelation therapy would be, I believe, if they test above a 40. And even then they're pretty hesitant to do chelation because it's pretty invasive. But yeah, so we don't typically offer anything. Sometimes they'll give them like a iron supplement or something because it could be that their levels are low because they're low, or their levels are high because the iron is low. But that's when we begin an assessment of the home and an assessment of the child. So that's where we'll identify, are they not getting enough vitamin C or calcium? Do they have a hand to mouth behavior? Have they been observed picking at things in the home, stuff like that? And that's when, again, we will test the home, identify what areas are positive so that they can remediate that, or at least keep them away from those areas so that they don't further expose themselves.
And I guess maybe some of this is coming from a place of ignorance with the specifics of kind of these medical issues. But is some of this, because if we're having, especially if we're having trouble, there's trouble getting people to come back for testing, are there still, like at these initial tests that they're given, are they given kind of like basic information about, have your kid take a multivitamin, or dust, or that, I mean,
Nutritional advice, like, more fruits and vitamin C, that sort of thing.
yes,
I
yeah.
can't speak for what providers offer, but I know that as soon as we begin case management, they're given a whole folder that will include information about how to reduce the levels with diet and cleaning and those practices.
Mhm.
I know typically doctors will mention something like things that would be helpful. So sometimes families are already aware of what can be done to reduce the level, but a lot of that education is coming from our staff once they open the case. But when CHWs or staff do events and they provide testing, they are passing out materials as well. So that
Okay.
even when they don't know what the level is, parents can be aware of how to reduce it without even knowing if it's high.
Okay, that's what I was going to ask.
And they're
Okay.
good habits regardless, even if your child doesn't have lead. What's a orange and a clean house gonna hurt? So
This is true.
So have you guys heard of zeolite for removal of heavy metal or no?
I'm not familiar, no.
That's a spray or a liquid drop that you can do that actually works really well for removal of lead. So it would be non-invasive. And then my other thought is, you know how we kind of bribe people with gift certificates and stuff like that? Can we incorporate that somehow in the follow-up testing for the parents?
And I think we have done that in the past. I know the community health workers have provided transportation cards like for Uber. Am I correct in that?
Well, I mean, like, here's a $10 gift certificate for Walmart. You know how we did the gift certificates? Like,
Yeah.
can we wrangle that in somehow that we could do that to actually encourage the repeat testing?
I mean, we can explore options on how to incentivize that. I know that we have recently been talking about tracking that data. And I would say some of the barriers for that is that not to shift blame on anybody, but sometimes providers aren't aware of what the requirements are. So our lead team is doing a really good job of meeting with different clinics and discussing that so that they're aware of what those requirements are. And sometimes it could be, the family just doesn't pick up the phone. They don't read their mail. I get a lot of spam calls. I'm sure they get a lot of spam calls. So when their phone rings, maybe they're not answering it. There's a lot of different factors on why they might not be aware. And when they are aware and choosing not to, that's a whole different conversation, but we could certainly explore possibilities to incentivize.
Just like at the initial discovery of it, to say, we'd love to see you back in 3 months. And, these are the things you can try, but, we give you a $20 gift card or something when you come in, and it's just more incentive. You'd think testing your kid and making sure it's fine, but that's just a little extra boost to go,
Yeah.
hey, come on in and we'll check you again. But and also I would research that Zeolite. It's super
How do you spell that?
Zeolight.
And I want to clarify that we would never be distributing that. That would be providers that would be.
Yeah,
doing
but
that.
you could educate the providers.
Mhm.
And there's another one called TRS, but it's way more expensive. But the Zeolite actually works really well for heavy metal removal, and it's safe for kids over 18 months old. Completely safe, and it has to be watch kidney function at under 18 months. Just FYI, but it's very cheap.
Well, thanks for bringing that to our attention. We can look into that. Thank you.
Any other questions or anything else you picked up on our reporting? I hope you also saw that the school health liaison, that we picked up on a new vision resource that was identified, and that enabled high schools to participate for a first-time free vision screening and receive glasses at no cost, which I thought was a great opportunity for kids that otherwise would not have lenses, corrective lenses.
Can you tell a little bit about how it works specifically? And is this a pilot program that we're hoping to?
Hi. So typically what happens in the state of Indiana, I believe it's grades 1, 3, 5, and 8, have a vision screening that's required that the schools usually have a nurse or a health aide perform. Then what happens from there is they'll recommend the parents to take them to see an eye doctor so that they can have further evaluation, because that preliminary is a screening, not really a test by an eye doctor. What we're seeing in the schools is that students are not getting the eyeglasses that they need to see books and also computers, and sometimes the board, depending on if it's near for vision. And then there's a gap between coverage, like for insurance, or maybe they've already had that one pair per year that Medicaid covers, but they've broken or lost their glasses. Dr. Bowling's practice does operate the Kindness to Prevent Blindness program. And typically they will go into the schools, and they also have a few mobile events, and they will give the eye doctor part of that exam along with the prescription, and then 2 pair of free glasses plus a certificate to get a 3rd pair for free, and then a 4th pair for $20. And that is funded by a grant that they receive. But Dr. Bowling's office has the contact that actually facilitates that. So we typically see the Kindness to Prevent Blindness program available in elementary schools, but during junior high and high school visits last week and this week, or 2 weeks ago and this week, they were asking about programs for dental as well as optical for the junior high and senior high. They were running into some roadblocks because there seems to be programs available for elementary students, but they weren't aware of any that extended. So we did confirm both mobile dentists for the students would extend to high school and junior high, and then also that Kindness to Prevent Blindness. Washington High School has their set up, I believe, for January, the first week the kids come back. And they actually have 2 days set up. They had that much need from students who failed that preliminary vision screening to needing glasses. And then also Jackson Middle School now has one set up for December. So those are programs that are available, and they just needed to be put in touch with them.
And is the hope, the plan to have this available at all the local high schools and junior highs eventually, or is it
Sure.
kind of a pilot program?
No, it's not a pilot program,
Okay.
but where the information gap was, we had long known that these programs were available for elementary schools, but just, is it available? And so I just called several, just made some phone calls and confirmed before I made the referral that they do extend to junior high and high school.
Oh,
Because by the time the kiddos are in high school, that vision screening is no longer required by the state. It goes like 1st, 3rd, 5th, and I believe 8th grade.
okay.
So I think that's where some of the need the unmet need was falling into place. And so they're very excited. And then Dr. Bowling's contact, one of the things we're looking to doing is also providing assistance with schools who actually do need help beyond that. So like, as school systems are decreasing nurse visibility and transferring to like health aides, there's some of that gets lost in the transit. So there's a lot of neat things in work, but that's probably like by far the greatest thing was seeing folks get excited that their kids that are in high school could get glasses literally for free. It's a mail-in program, so they're aware that, they don't, it's kind of like if you go to the local eye doctor or the mall, you can get your glasses sometimes like within 2 to 3 days or a week. These actually can take, 2 weeks to 2 months because it's mail order and it's provided on a different type of funding source. But so far the feedback's been it's been really good. And they're excited to have that. So as far as letting all the schools know, we did put together a newsletter for the month of November, and both the Kindness to Prevent Blindness program that was included in there, and that goes to whether it's a nurse or a health aide or even our supervisors over those programs. I think we sent out like 118 emails like in one shot, and so that went out to everybody last week. So as we get those calls in, then what we would do is provide them with that information and say, if you don't get your call, because I've had some like with mobile dentists that staff says, well, we don't get a call back, or we like vaping information, we don't get a call back. So, I can help you with that. So then as we get those calls and inquiries, we'll confirm the service is available still for their particular age group and then help them to facilitate appointments. But so far it's really taking off. And I was really pleased when I followed up that there were actually 3 pending dates. So.
Good. That's a great idea. Thank you.
You're welcome.
In what context is the vision screening done for students? Is it on a school site or is it a referral to someone else? And then
Excellent.
what's the follow-up process to
Sure.
make sure kids receive, whether it's 2 months or 2 weeks?
Sure. So this is a voluntary program. So for example, the contact at the school would reach out to parents and let them know. They're required to notify them that they did fail a vision screen, but maybe a teacher sees that a student is squinting or they're getting headaches a lot. That's also our trigger. But they would, once their glasses are ordered, it's whoever that contact is at the school, they would then wait and root for the glasses to come in. And typically, I did come from a school health care background. And so what we would do is just follow up. And then when they arrive, we actually pass them out at school. They get 2 pairs because sometimes kiddos lose them. And so they'll keep 1 pair at school for the younger kids and they'll send 1 pair at home that they can then usually lose. But so that's our process. So Dr. Bowling's office facilitates that. And my experience with them is I've not seen a child whose parent enrolled them in the program fall between the cracks, but it is something that the school themselves would be responsible for following up on.
Can you explain the process for the vision screening for grades 1, 3, 5, and 8?
Sure. So that is typically done by a nurse, but as more and more schools are either having a health aide or even office staff cover, that's kind of been the sticky wicket. But they would have somebody come in and it's called a screening instead of a test because we're not eye doctors. And so we can't do a vision exam, but we would use like the Snellen chart with the letters or the chart that's got the pictures for the younger kids. And we would perform that at reading distance and then at 20 feet. And we would go off of that to see if they triggered, they have to have at least 25 vision instead of 20/20. And then from there, the referral is made. I don't know if that answers the question. But then also students who are not inside those grades who are having difficulty or suspected to have vision problems, or maybe they've said, hey, I haven't worn my glasses in 3 years, then we can give them a screen too. And then we can reach out to the Kindness to Prevent Blindness program and say, hey, we don't have that scheduled at our school, or maybe we've already had it for our year. Do you have another school that we could take our student to, or do you have a mobile? They come via a mobile, I guess you would call it an RV. So, and that was obtained through a grant. And then they will actually go to the schools or they'll go to an event in the community. And so everything's in there, including racks and racks of glasses. So it's really remarkable. They just kind of go in one side of the RV and work their way out the other door. So it's very mobile. Did that answer
With
the
the
question?
number of students we have in St. Joe County attending public, private, charter, parochial schools.
What is the number of students in St. Joseph County? I believe.
No,
it's 15.
I know what that number is, but
Oh, okay.
I'm curious as to what resources you additionally need to make sure that we're covering all of those schools adequately.
Oh, thank you for asking that. So far, because of this amazing program, which continues to receive support and sponsors, to my knowledge, as long as those parents sign up, I'm not aware of any students. And of course, we'll continually get feedback and that'll be something to look at. But as long as the parents fill out the consent form for them to participate, no child, to my knowledge, has been turned away. And it's a free program, so they don't need to produce insurance or Medicaid or cash pay, copay, that type of program.
So
So it's pretty remarkable.
yeah, I know things start small and get bigger and
Mhm.
expand. As Dr. Bowling, he's been doing this kind of work for many years. So
Yeah.
do you know if there is a larger plan to include all of those school corporations and schools?
I don't know that I can speak to that. I can say that the information is there and available. And as I visit the schools, I ask them what their needs are, because their needs may be very different from what I put in the newsletter or very different from what one school has a need for. One school may have a very strong need for example, hygiene products. Another school may have that need for unmet dental and optical. Another school that I visited had a very strong need for mental health or emotional health care. Another school has vaping. So just as we learn those and then connect with them. And then so far, we've been very lucky that we've been able to find viable resources for them. I'm fairly new in this position and kind of just getting my feet wet. But thankfully with that experience that I had as a school nurse, I'm familiar with the resources that are out there. And so far, the only brick wall that we're running into that I foresee is once we go through our, like the fair funding and our supply closet, I'm concerned because students, so like a big part of being successful in school is being able to see, not having students with throbbing abscessed teeth. I mean, then we had a kiddo in Maryland, unfortunately, who passed away from poor dental care because they developed an abscess. That's a reality. Thankfully, it's only one, but so those are the types of things. So once we meet that, are they hungry? Because we have Cultivate who can come in and they provide bagged frozen food for schools that the kids can grab on their way out on Friday. And those are like 2 full meals per bag. And each kid can grab 2 bags, so that's 4. So there are a lot of different resources and programs available. It's just finding out what each school's need is and then connecting them to the right resource. And then, of course, following up with them to see were those needs met or did they need assistance? As we're going through supplies, because excuse the crassness of it, but it is called period poverty. But that is a very serious issue in our schools right now. From menstrual supplies to change of underpants and clothing, students, male and female alike, are not having deodorant. They're embarrassed to come to school. They don't want to take their coats off because then the odor becomes more evident. And so from that perspective, it's hard for them to sit in the classroom and learn and actively engage at the level that the teacher needs them to, or to even go home and maybe they don't have any support there either. So those are some of the, that's the span of needs that we're seeing in our schools right here in St. Joseph County.
Thank you for all your work there. One other question. Are you
Sure.
familiar with any auditory issues that run similar to Dr. Bowling's program? Because hearing is instructionally one of the major reasons kids do not hear and therefore can't process. Is there something out there that you're aware of that, as we talk about vision, hearing is equally as important?
Right. And so that's a great point. And the state of Indiana requires students to have a hearing screen at first grade. I want to say 4th grade. And then there's another grade, and I don't recall what that upper grade is. So all students in Indiana schools are screened. If we have a new student who transfers in, we have to screen them by the end of the school year. Those numbers are reported to the state then. And if the student does, vision and hearing are very much treated differently. With vision, we can give the parent, unless they're legally blind, we give the parents the referral. They're obligated to take their child and find eye doctor and glasses, but we have this amazing program as a resource if there's need for that. With the hearing, if they don't pass it, they're recommended to go see a specialist. But then there are also somebody who, like a audiologist that the school can actually use for, because at that point, they usually will have a 504 plan in place to help accommodate that special need. So hearing aids are actually available on loan for students. They like size them up and see what type of hearing loss. So that actually is much more complex and complicated. I'm not aware of any program out there that's comparable to like mobile dentist or the Kindness to Prevent Blindness program. It's just never really been an issue because they have a whole different, another program that's covered under, it's considered more of a health thing, and the school can they have an audiologist who will actually visit and who they can refer the kiddos to. And those numbers are like, so like in a school of 400, we may have 1 or 2 kids with a hearing disorder. That's a great question.
Thanks for your team's efforts and your efforts, and we have a lot of work to do.
We do. And vaping cessation is tremendous right now. So we're partnering with a couple of different agencies locally. I was really surprised yesterday at a visit that I made to a junior high school that it isn't just the nicotine that even junior high students are addicted to, it's the THC, and it isn't even legal here in Indiana yet. So it's heartbreaking. And the second great need that we have is mental health. And so we found a program that not only is looking for 60 high schools in Indiana, but they have 6 openings for junior highs as well, that is a peer-led, fact-based, evidence-based, successful program that helps equip kids for success when they've had very traumatized lives, and a lot of our kids have. And they also will give $500 annually to the schools as an incentive to use for whatever, whether it's copies, snackies for the kids to come. And those are just resources that, as we learn about them, and I put that in our newsletter as well, that we're letting the schools be aware of. But then it also does benefit them having someone make an in-call, in person. I call it a cold call if I don't have an appointment, but just to kind of catch them and say, hey, I know you got the newsletter. Did you read it? What needs do you have? What's the needs of your student population? Because it varies from city to city, or even junior high to junior high, or high school to high school right here in South Bend. It varies tremendously. So that's really neat. That's kind of like it's a great thing to have them say that they were able to get that vision program set up. And also mobile dentists are a big need too. The 2 that service St. Joseph County, they will take insurance. They'll do all the billing for the schools. That's already in our elementary schools for the most part. But that was another program that the contact at the high school said, hey, what about dental health? I have kids who need dental health, and these kids are sick because they can't eat, or, they've got these different things going on. So connecting them with that and having them say that they heard back and they're getting that scheduled has been wonderful. And again, those are already things that schools were encouraged to do at the elementary level. It isn't required. But I think sometimes as the kids get older, they just stop complaining. Maybe their complaints have fallen on deaf ears, and now they've got these sweet social workers and school nurses who are in there, and health aides who are hearing them and then being able to voice that and then get connected. So I'm very excited about the program.
One more question. I have one more. Okay. With Madison Center for years providing mental health services to schools, especially in St. Joe County, and with their void of closure, do we have, and I know Oak Lawn picked up some services. Do we have anything on a countywide basis similar to vision, hearing, that's focused on mental health?
Yeah, that's a great question. So do we have a program that focuses on mental health that's in the school? Each school will assess their need, and they do have a social worker available, and they will provide some services and even mentoring, depending on what their student needs are. Is that available on a wide scale basis? I really can't say, but just so far from my windshield view of the schools that I'm going into, no. I feel like we have students who are traumatized and are barely making it home in schools that are a safe space to go to. And are those psychological, extensive, complex needs always being met? I don't know. That's one thing that we can offer is the peer that evidence-based successful program. That's a start. And also training for the teachers is what I'm hearing, because teachers are looking at students like, this kid is having a problem. He's not listening. Therefore, I'm sending him to the principal's office to maybe get in timeout or in school suspension, out of school suspension. But what we're not necessarily is trauma trained to recognize this kid maybe thinks differently. This kid is maybe traumatized by something in the classroom or triggered by something. Do we need to look at it a little differently? In theory, all schools are trained to spot that and respond to it. So we have IEPs, we have 504s. We also have school psychologists now. But do kids fall through those cracks? Absolutely. And so that's another reason to have those peer-led group programs that are willing to go into the schools and get them started and give them some money to start it up as well. But I think as far as Madison went, we do have a inpatient like they are in Plymouth. Oak Lawn will do free screenings for people who need it, but you kind of have to, with one school I shared, they have to show up on a certain day of the week and then they just wait there because a lot of the pediatric psychiatrists in our area and even counselors, they have a backlog. Our Department of Child Services puts in referrals for kids that are in the foster care system. I am a court-appointed special advocate volunteer, and I still have kids on caseload volunteer-wise. And so I know personally, it does take a while sometimes to get those kids into services. And so for an emergent situation, we would recommend them to reach out to a pediatrician. If they don't have a pediatrician on hand, they may have to take that child to the emergency room to have them evaluated for placement from the emergency room. But the goal would be the schools would see a need, recognize it, and reach out. And I do believe that the schools have some great systems in place for that, but I still do think that we have kids that maybe don't rise to that level that would benefit from emotional or mental health support services. So we can only look at like what's fact-based and evidence-based and what's worked and becoming nationally. So it's called the BC2M program is what it is. And it was co-founded by Glenn Close, but there's also sponsors here in Indiana that are putting monies into it to make this available. So I'm excited to see that in the particular schools that I visited. You know, some schools you walk through and you're getting these warm fuzzies and like, oh, this is what I remember school, or this is what my last school was like. And then other schools you walk into, yesterday, I won't say the name of the school, but it was just palpable what the difference was. And I got out in my car and just felt horrible. And so they were a priority today, last night and today, and we got them connected with services. And we followed up with services and they're following up with services. And so that's the good feeling. That's the great, aha, that's why we're here and that's why we do what we do.
Thank you
That
very much
answers
for your commitment.
Yeah,
Okay, let's talk further.
okay.
Can I ask a follow-up with the vision program? You said that when they are failing their screenings, you boot that to the parents, but is there follow-up then to make sure the parents are following up, meaning they're getting them into the program?
So my understanding, and this is based on, I think it's Indiana Code 4, that applies to schools, and this would be the school's responsibility is they have to provide those screenings, and then they have a referral form that they provide. I know I can't speak for all the schools, but the golden policy at the school I left was we would call the parent to make voice contact with them, and then we would also send the form home.
But
There's
then
there's a
is there-
there's a backside that they then complete, and that gets sent back to us. In addition to that, so there is some follow-up there. And I'm sorry to say this, but we just have some parents that are like, I don't care what you send me, I'm not taking my kid to the eye doctor. That just is a reality. But then in addition to that, for students who do have those unmet needs is where then we would resource with Kindness to Prevent Blindness. So,
Somebody in the school does that?
pardon?
Someone in the school does that? Meaning if the parents don't do anything,
What we would do is call, so I can only speak to what our standard was, but I would call the family and say, hey, just, following up, I know that she didn't pass our vision screening, which is not a test by an eye doctor, but it's a screening. Were you able to get an appointment or do you need some resources? And they would either say, yep, I have an appointment. We'll send it in, appointment 6 weeks out or whatever. Or nope, I don't have any resources. Thought I had insurance. I don't. Great. We have this program that we can refer you to. If this is what it's called, I'm going to send this paper home with your child, or I can email a PDF copy of it. And then once, and so, but it does require your consent. And then once they fill that form out and either scan it back or send it back, then we take it from there. Once we have their consent, it just goes real smoothly with Kindness to Prevent Blindness. We do maybe have some parents who say, you know, I'm with him and I think he reads just fine. And 2 years ago, I got him glasses and, you know, he broke them or lost them. And so we can try, but ultimately at the end of the day, it's up to the parent to consent. And the school has met their due diligence by providing that information, by providing that screen and providing that referral. The school has met their due diligence. And we can take it a step further though, by saying, hey, we're going to bring mobile dentist in, or we're going to bring in Kindness to Prevent Blindness mobile program. So I wish we could catch every kid. But just having this available is going to catch a large number. I know the high school, I talked to Dr. Bowling's office today and they scheduled not 1, but 2 days. So that they had 80 students. So that's 80 students with pending appointments. So they failed the preliminary exam with the school. That's 80 students. Now, sometimes Dr. Bowling's, and it's either him or his partner, there's one of like 3 or 4 docs that'll do it, but sometimes, and they give us a copy that says, okay, thank you. The student actually has 20/20 vision and maybe they were having a bad day or it was too late in the day for them. So some of them end up not needing glasses. Most of them, I'd say about 70% do. So that's our goal is, you know, I wish we could catch every kid. But I think too, as it's kind of like the first mobile dental visit that I had at the school that I left. The first time I only had, I want to say 10 kiddos signed up and they're like, you know, we have to have at least 20 because we're for profit. And we only had, I'm like, but this was our first time. Give us a minute, you know, give us a minute. So then the next time though, we hit that limit. And now this year the principal said, you know what? Because I had said, hey, we could do this twice a year because typically kids go to the dentist every 6 months. I can tell you that I have had parents say to me, huh? We're supposed to take them to the dentist every 6 months? Oh, how often did you think that your child would need to go to the dentist if they have a toothache? And this is something that we're seeing is cyclical. And like for you or me, our kids went to the dentist every 6 months. They had their vaccines. If the doctor said, get them this antibiotic, you know, they went to the pediatrician. We saved the emergency room for true emergencies. Many of these kids are using the emergency room. Their parents are using that as primary care. And then the school, and then oftentimes I would have kids say, my throat's been hurting me so bad. My mom told me to come see you. And I look in there and, oh, looks like strep throat. I can't say that though, because I'm not a doctor. So then I can call the parent and really encourage them. So that's the type of thing that we might deal with. But it's also a blessing because I do feel like our kids are getting a quality education here in St. Joseph County. And I feel like having somebody that can specifically reach out to them, they may not respond to, I don't know, they don't respond to phone calls because they're seeing, you know, 50 to 70 kids a day or emails, but they're responsive to in-person visits. Some will respond to the emails and calls though. But so I think there's some value in that in the programs, and I'm excited to see more programs pop up and learn more. So I'll definitely keep my eye out for more programs and check into auditory as well. But from my understanding, the school's got that covered.
A question with the Dr. Bowling program, is there an income limit on that?
No,
Or- Okay.
no, this is, my understanding is it's grant funded. And then there's some, and I don't know how their financial piece of that works out, but no, there's no income gap. If they're very gracious. Last year I had a new student transfer in and I had already had my Kindness to Prevent Blindness day, as did my coworkers in other school buildings, and they plugged us into a mobile event for that kiddo. And so they actually go above and beyond. You know, they don't just say, well, we've already been to your school and we're not doing your area again for, you know, they actually plugged us in. And so that's like a beautiful thing.
Because the other question that I had is that there's a not insignificant number of kids in the area who are homeschooled, who are doing online schooling, something where they're not, you know, full week in a school setting and getting educated in a different way. But I could see families, like wanting to have, know about and have access to some of these health programs that are otherwise provided through the school screenings and things. I mean, this vision program, it's like, I can think of a lot of people who might not have a lot of money, maybe their kids doing online school
Mhm.
and, having like awareness of where can they go for, so that their kids can get, those, same sorts of, screenings and things. Is it a matter of, can you partner with the school? Do they have like a mobile day or a day where, it can be more of a community day for
And they
kids?
do, they actually do, they do advertise and they do have community events that they attend.
Okay.
And that would be their, like mobile where they would say, hey, we have this community event and this community event.
Okay.
And so your parent can plug in, here's the website to go to for that. And I can't speak to all schools, but I can speak to the school that I came from. So we have a list of the students who are physically in person at our school. And then we have a list of students who are like assigned to our school because they live in our district, but they are homeschooled. A
Uh-huh.
lot of those kids, many of them are actually linked in with a homeschool
Mhm.
program. And we do have some of them on our email list and our contact lists
Okay.
that we provide out to. The other thing is, so for my students who were not physically present in school, they're homeschooled,
Mhm.
we have the parents' name and number, and we would call them and say, we're doing grade 1 vision and hearing screening in this, in next month. Would you want to bring your child in? Nope, they already get that taken care of at their own doctor.
Mhm.
So that is, and I can't speak to other schools, but I know the system that I was in, we had a mechanism built in place for that.
Okay.
But it certainly doesn't hurt to advertise,
Yeah.
for sure.
Yeah. Thank you.
You're welcome.
Do we have a place, I think I've asked this before, but is there a specific page on our website that lists community resources in even just like a list format? Like eyes, dental, like all the things we offer, food and
We have a link to community resources on our CHW page.
but not, is that something that would be easy for people to find, I guess? Like it almost feels like it should be a tagline right in the front on the first page, community resources, click. Because if people have to really search,
Yeah.
they're gonna just be like, I can't find it. There's nothing.
We do have printed papers that we give to people with clinics like HealthLink, Indiana Health Center, the residency programs in town for accessing medical care. So we do have those flyers that we pass out when people come in.
I wonder also if somebody's online, I mean, the default now is Google in community resources for X, Y, and Z and see what pops up. So it might,
It'd be good to
be
have
a-
some kind of media online presence where we'd pop up in those search engines. That it's just all spelled out, everything that's available.
Do we have anything in our like Facebook, on our Facebook page?
Not on our Facebook right now. That would be easy to put a
Mhm.
link for community resources on there too.
Just because I feel like I've been on, I don't know how many years I've been on the board, I had no clue this was a thing. I'm like, how come I don't know that? And so I think probably a lot of the community doesn't know all these all the helpful things that we have. It would just be great to be able to find it.
That's why I think it's great that she does the newsletter every month to talk to every school, whether it's private, parochial, public. She will send out this newsletter. That's why she sent out 118, just to tell them about the Kindness for Blindness. Here's an opportunity. If you want to do it at your school, call this number and set it up. So we do
Yeah.
try to,
It would just be something I'm thinking like if somebody is normally not used to accessing help and they lose their job, then they just feel lost. I don't know where to go. What do I do? They don't know where to start even. And that happens.
True.
I had a patient who her husband died suddenly. She had 2 little kids. Utterly
blah.
surprise abandonment. Yes. And so she had no clue how to navigate all that. And it would have been great to be able to go here. This is every resource available and even to reach out to community health workers. People just they feel almost ashamed if they've never understood how it's there to help them. But if they could do it and see it and it would be just more readily available, I think we'd reach people that we never would otherwise.
Yeah, I appreciate that. one thing that I heard today, that I learned today, and I'm not sure of the specifics, but like one of the tremendous resources that the Community Health Workers Program provides is helping folks get plugged into insurance, even if that's applying for the state insurance or Medicaid, as people used to call that. And my understanding is that's decreasing or diminishing. But, we have people who come into the school too, and they've had house fires or they're homeless, they're couch surfing. And so there was availability in our situation that we have a computer available at the school and we can set them down and go take them to the website and we can click on Espanol or English and they can get signed up for that. So that's definitely a resource. And even though we think that everybody out there should be computer literate, I mean, I'm still learning stuff on the computers the last couple of months I've been here. But not everybody is, or they have the iPhones, but that doesn't mean they have the computer that's big enough or gives you the full thing. So that's definitely, I love the QR scan codes because parents can easily use their smartphones for that, but
Well, even kids, like I'm thinking a lot, I mean, most people my age are not having children. They're not as illiterate as my generation and older, but kids can actually, if they had a way to scan something, they could present it to their parents even, because as teenagers, they sometimes are parenting. And so that way they could say, hey, look, mom, I found this resource for my little sister Sally who has her teeth falling out, and the parent would not maybe even go that direction. Just, I don't know. I think that we could revamp some of that where it's just easy for kids and teenagers and even people that find themselves in situations where they just don't even know where to go.
I would welcome further conversation on that too, and collaboration
Yeah.
to take that idea and just really run with it. So thank
I'd
you.
love to see that happen.
Okay, thank you so much.
I'm sorry, I just wanted to interject one thing. I was just briefly reviewing our website. So we do have a community resources page that is under our CHW program. And that links to a community resource Indiana 211 database. And so that's sort of the clearinghouse for the area. And that lists a huge number of resources. Their role is to keep that updated and up to date.
Privatize things and
I'm sorry?
including privatized things. Like, remember we had that, I cannot think of her name. She came in and talked about counseling for loss, like grief count. Do we have that also on those pages? Not just our own resources, government resources, but community resources that are available for people. Do we have that? Is that
Like you're
included?
talking about Justin's Place is what you're
Yes.
talking about.
Yes, just because there's a lot of, like, even where can I get food? Not just where like every place. And you said it's under the CHW page, but is it on the very
It
first
is.
page?
And usually in my previous work, 211 usually is elevated on Google searches when people are seeking out resources. So it's usually on the first page, if not near the top, that they can go into.
Someone just said, where do I get food or where? do I
And
get
that's how it's
explained
arranged.
Or whatever.
So if you need utility help, there's links to that. And it's based by county. So it is important that you're on the correct county that you live in. So I don't know all the IT wizardry behind all of that and how that works. Assume it's location based. So wherever you are at, you're probably pulling up that current county. So it's not something that we maintain necessarily. It's something that I believe, if I remember correctly, I believe it's something connected to United Way. That they maintain that. But it is a third party. We're
Okay.
not part of that.
It wouldn't be so local for, how churches
Mhm.
will have just pantries and there's a lot of that happen with all this, not being able to get staff benefits but I would just love to see it right front and center, not looking under CHW, like people that have never accessed this wouldn't even know what's a CHW. They wouldn't even have a clue. I don't know what that is. And they'd look just at the first page. It'd be great to be.
We can look to that.
So.
Thank you.
Any other questions about the health officer report?
I have one item, and it covers the whole context of the discussion for so far. Back some time ago in schools, there was a movement to deal with children's success at school and then looking at all the deterrent factors of what are the measurements of those. In Kentucky, back in the late 90s, early 2000s, mandated family resource centers in every school in Kentucky. And family resource centers meant that they were going to focus on eliminating all non-academic barriers to a child's success in school. Eliminating all non-academic barriers. So whether it's dental, it's vaccinations, it's whatever. And every school in Kentucky had that. Fortunately, there was a group called Connect, and we were part of that group that led a team to visit Kentucky schools and came back and then studied that, Connect, and adopted that model for St. Joe County. And some districts, such as PHM, adopted that. I happened to be with New Prairie. Later on, we adopted that model. There's an 8-point premise. Not too much tonight, but I would encourage everybody to go and look at the definition of family resource centers in schools. And you can start with Kentucky. But school buildings later that we had some influence over in northern Indiana and Chicago, in building new buildings, constructed family resource centers, which included job trainings for parents, work placement, all the medical, all of the social services that you might find. And so it's not a unknown subject. It's a matter of, does your community support dealing with the issue of eliminating all non-academic barriers? And if they do, there's a way to do it. And what you've identified is vision, which was one way to deal with that area. But then you have another group, mental health. Madison Center was involved and Oak Lawn was involved in St. Joe County. So there's a lot to learn from all that. But I would encourage you first to look at that concept of family resource centers in schools. And it wasn't just public schools. It was parochial and private schools as well. They have the same issues that public schools have. So we'll talk later about that maybe and have a discussion, but didn't want you to think there wasn't hope, okay, or history.
Thank you.
Okay, if there's no other questions, then we'll have a vote to approve the president or the health officer's presentation.
I will move to approve the health officer's report.
Second.
All in favor, say aye.
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 Opposed, same. Okay, moving on. Are we doing a spotlight then? Okay.
Spotlight tonight by Environmental Health.
I feel upstaged. I feel like I'm the second unit spotlight tonight. But if you're ready for another one, we'll get moving.
Mm.
Okay, hello. Again, Brianna McCall, proud director as of yesterday of the Environmental Health Unit. I'm pretty excited to show you and highlight some of our programs within the Environmental Health Unit, our staff, our programs, and our successes. Sorry, I jumped the gun, Jenny. It's giving away my speech. Well, while they're figuring that out, I can just kind of launch into it. So this is our team. We are a team of 10. From left to right, we have Leela, who's here tonight in the audience. She's our new vector specialist. Pat, Kara, Melanie, Jessica, myself, Amelia, Katie, Josie, and David. So we're a pretty strong team. We're definitely a team that helps each other. It's been a challenging year, but we are definitely united and strong and comfortable with one another. I know anytime I've needed help, they have been amazing help to me, and I hope that I've been an amazing help to my staff, but I'm very, very, very fortunate to work with these people every day. We are a solid team and we're doing a lot between our programs. We have many, many programs. Some of the heavy hitters that I'll discuss will be septic, water, lead, radon, vector, of course, healthy homes, property transfers, and massage and tattoo. So we have a lot going on. We have a lot of codes to follow. It can get confusing at time, but like I said, we have a really good team. You can, yeah, that slide's good. We have a really good team, so we're able to help each other get through all of the challenging parts of it. So before, I'm going to dive into 4 of our programs heavily tonight in the interest of time, but just to give some general updates across our unit as a whole. You may have seen that last week the county council approved our massage ordinance. So I just want to take a moment to say thank you to you guys for your support in getting that moving forward. We were very excited to see that that passed with full support from the council and obviously from you guys as well. So I just want to say thank you. We really feel like this allows us to do our part in protecting people who visit and work in these establishments. So again, I just want to express thanks.
Quick question. Does it go to the commissioners now? And
I believe so.
have they voted on it?
I don't think so.
Not yet? Okay.
Yeah, we anticipate that this will go in effect January 1st of next year. I don't want to get too excited, but I'm excited. So, so that's one update. 2, I already touched on. We hired Leela, who is our vector specialist. She's been a great addition to our team, and she's very passionate about protecting public health from vector-borne diseases. And then 3, I have been working with our administrative staff, so our administrative assistant and our staff assistant, to think about how we can kind of restructure things. I know in a lot of places, things can be done the same way for many, many years, and we forget that it's good to look at it with fresh eyes and think, how can we be better? So we're kind of thinking of how we can better organize, better issue permits, better respond to the public. And so we anticipate in the year you will find things are different, but we hope that those different things are helpful. So like I said, I'm going to focus on 4 programs specifically so that we're not here till midnight, because there's a lot that could be said about our unit. So I'm going to start with septic, radon, healthy homes, and vector. So we will start with septic. I know everybody loves septic. It's everyone's favorite thing to do is file for a septic permit. People love it. They call in they're so excited about it. It's their best part of their day. Our staff follows Indiana Rule 410 IAC 6-8.3. So in doing so, we process applications, issue specs, which specifications, perform on-site inspections, issue permits, and then perform final inspections. And all of that is done to ensure that people are not exposed to effluent or bacteria. We want to be sure that people have functioning septic systems. In the world of septic, we want to be more efficient and we will be more efficient. So currently we're looking at revamping that a little bit. We had a plan to utilize a system that would be forward facing to where the public could track their septic permits in real time. That system has not materialized quite yet. So we are working with our data analysts to develop a REDCap link. This link will be sent out whenever someone applies for a permit, which is usually done via the St. Joe County website. So once they are issued, or once they submit that permit or the application, they will be sent a link. That link will show them step by step what needs to be done and when it is in progress. So for example, let's say someone submits their application, we issue the specs. The next step is that they would submit a drawing to us. Currently, we would call or email them to let them know that, but this system would just prompt them with an email and a text right away saying, hey, time to submit the drawing. That way it kind of makes it automated so that staff can focus on what needs to be done, and it's not an internal error as much as it is the system automatically pushing that out to them.
Can I who does that go to?
So whoever were to apply.
Okay.
Yes.
Can that go to more than just the person that's applying?
Yeah, since we are in the development stage, we could certainly look at doing that. I think that's a great idea.
Yeah.
Yeah.
Okay.
And there are usually multiple hands in a septic permit, so that's a wonderful idea. Thank you. Yeah, so our hope is that this will show more transparency and that this will show progress in real time. Again, it's not the jazziest thing of all time to file a septic permit. And so we want to make it easier. I purchased a home this year. It was super complicated, all the different things you have to do. And when we got some work done on our septic system, it was pretty complicated. There's a lot of things that the average home buyer or homeowner is not going to know. So our hope is that we can make this simpler and more helpful. We don't want to hinder people. We want to help them. So our goal is that this will be better. But because it is new, we will accept as much feedback as people want to give us as we're rolling that out. Additionally, we have created a feedback survey that we hope to send out next week. This will go to septic contractors, title companies, realtors, whoever, just to get a sense of what are the most important things to people right now that would be beneficial to them. Because again, this is a complicated process and we want to make it easier. So what could we do better? What is just the general sense in the room? And we think we have an idea of what the feedback will be, but we just want to be able to document it and hope that over time that feedback gets better. Further, our septic staff recently were trained at Staking University to operate GPRs, which is a ground penetrating radar device. This will allow them to detect materials that are below the surface. So this is helpful in identifying septic systems, but it's also been contracted. We've been asked to go to other locations for other things, which is now a paid service starting this year for the fee schedule. So again, we recognize how confusing and complex this can all be. So our staff is working diligently to be more educated and more helpful. Next slide, please. All right, next I'd like to highlight our Radon program. So roughly 1 year ago, I stood before you for our unit spotlight last year and highlighted our Radon program, which at that time was in its infancy. So I didn't have much to say about it currently as much as what we were hoping to do. So I'm really excited to share what we have accomplished in that year. So to date, we have distributed 811 kits. That has been distributed through our building as well as every St. Joe County library. And that's also Mishawaka Penn Harris Library. So pretty much any library you're going to go to in the county will have a radon kit available. So we've given 811 kits. We've done 13 presentations on our radon program. That has been received very well. And we have remediated 49 homes. So that process is that if somebody does have an elevated kit and they income qualify, we will send them something saying that we can cover the cost of a remediation system. But again, they have to income qualify. It's not just for anybody who asks. Before we began our program, the EPA estimated that 1 in 15 homes in the country would have high levels of radon. But that in St. Joe County be 1 in 4. Our data aligns pretty closely with that. Our data is showing 1 in 3.8, so pretty much 1 in 4. But I really want you to pause and think about what that means. 1 in 4 homes. So that means you have a 1 in 4 chance of living somewhere with an elevated level of radon. So you have a 1 in 4 chance of breathing in air that would be the equivalent of smoking 8 cigarettes a day. So we know that radon is the second leading cause of lung cancer. We know this is serious and that it's very prevalent in our county. That's why we're really proud of the work that we have done and the education we are putting out into the community so that people are aware of it. Jessica, who you see here on ABC 57, she did WSBT in January for Radon Awareness Month, January, Radon Action Month, October. I love that they got 2 months. They said, here's where we're going to talk about it and here's where we're going to do something about it. So both months we were present in the community to talk about our program. Okay, next slide.
Can I ask a quick question
Sure.
about the kits?
Yes.
I think we bought a certain number of test kits with the
Correct.
HFI money.
Correct.
And how many do we have left?
You know, we were just talking about that today. We don't know how many we have left. Like, I can't quantify it for you, but I'd be happy to look into that because we were actually just having that conversation today about when we needed to order more, how many we had in stock. So I'd be happy to get that information to you, but I don't know at the moment.
Okay, because I was also wondering if there are other funding sources. I mean, grants to.
Yeah, we're
Is
definitely
that-
looking ahead at what we will do because we want to continue this as long as we can. But at this point in time, we're still relying on HFI funds for that.
Okay.
Okay. So next I'll talk about Healthy Homes. This program can be overlooked at times because it can get messy, but it is vital to protecting the public health of the residents of our county. A Healthy Homes inspection is typically done in response to a complaint from the public. So they'll either call in or they can submit a complaint on SeeClickFix. SeeClickFix is the entire county's complaint portal. So you can submit a complaint about anything. Your neighbor's grass is too high, that would go to code enforcement. Your neighbor has an excess of food waste in the driveway, that would go to health department. And that would be an example of a Healthy Homes complaint. But these complaints violate Indiana Code 16-41-20. Complaints may include animal feces, human waste, garbage. The difference between garbage and trash is that garbage has food waste. So if there's no food waste, we don't do anything that would go to code enforcement, county code enforcement. But if there's food waste, that would be health department because it could attract insects or animals. Hoarding, again, has to include food waste. No active water service, that's a big one. Open burning, open dumping, complaints regarding motels and hotels, such as like bugs, things like that. Meth labs, and then unfit dwellings. So that would be a dwelling that we deem unfit for human habitation. So those are examples of why we would go out. And so in the photos, you can see top left is an example of food waste that was left outside and was attracting animals. Top right is an RV that was being lived in but did not have water service. So they were dumping their human waste out in the public. The bottom left is hoarding that involved food waste. And then the bottom right is animal feces. So in these situations, we go out, we investigate to ensure that the claim is substantiated. And then we would type up an abatement order to let them know they need to remedy the situation, often just cleaning or just making it livable. Oftentimes, we see that these are results of mental health struggles or financial struggles. So it is our duty that we navigate these complaints with empathy and enforcement at the same time, which would otherwise be very complicated, but luckily our inspector is a pro. We get a lot of positive feedback because of how he's able to navigate these situations. And like we've been talking all day about pointing people to resources. Some of the resources we would point to would be Adult Protective Services. They have scaled back on funding, so it takes a little bit longer, but they're still an amazing help to us. Real Services offers a lot of help. And then honestly, a lot of local churches can help as well. So sometimes they might not have the money for turning on their water. They might be able to help them with that, or we'll just find a resource to help them. An example of a time where we were able to help somebody and again, enforce the code, but lead with empathy would be early this year. Our inspector received a complaint that a woman was hoarding a lot of food waste on her apartment balcony. So he went out to investigate and found that it was an elderly woman who was struggling to physically bring her trash down to the apartment trash bins. And so in that instance, he physically took her trash down for her. And then he went to the main office and created or worked with the property manager for a long-term solution to where somebody in maintenance would come and get her trash for her. She was a little embarrassed to bring it to their attention. A neighbor had called us to complain, and we just kind of facilitated that for her. So while we do have to enforce the code, it's not always with a fist. Sometimes it's a helping hand. So we're pretty proud of our team and the positive feedback that we get for that. Next slide. And lastly, I'm going to highlight our vector program. In the past, we focused pretty heavily on larviciding or on collecting mosquitoes, but going forward, we really want to focus on larviciding and spraying. So Leela, who is here tonight, she's been working closely with the state to develop some plans for 2026 and how we're going to target spray and how we're going to approach larger events. So it's not something that's set in stone, but we're exploring the possibilities of, for example, the county fair, spraying before the fair so that when there are large groups together, there's not a large amount of people exposed to mosquitoes that could be potentially spreading diseases. But she's going to focus before that on resistance testing. So we want to make sure that what we're using, the chemicals we're using in spraying and larviciding and all that, that the mosquitoes in our county haven't built up a resistance to that already. It's very possible that they've been exposed to this chemical for so long that they built up that resistance and they're like, that's not going to kill me. I'm good. I've seen that before. I'm fine. So Leela's plan is to focus a lot on resistance testing before next summer. She'd also like to focus on creating more education to the public on what is included when you spray. We don't want people to be afraid of spraying, but we also think that they have a right to know what these chemicals are and what they mean. So it's not enough to just, I could spout out a bunch of chemicals. That's not going to mean anything to a lot of people. So Leela's passion now is to create something that the public can see that will explain what's happening and why it's safe. We don't want them to be afraid of it. And it's not something they need to be afraid of, but that's something we want to do is focus on education. She also will hope to partner with the Parks Department. We have a lot of tick education materials that we want to disperse amongst the parks. We've had projects here and there, but we want to just, again, focus on education. That is the key to everything. And so we want to disperse those materials because they are helpful for the community to know how to prevent tick-borne illnesses. And then lastly, I want to focus on complaints we get about abandoned pools. So you can see an example here in the photo of a pool that was left abandoned for a very long time. I'm not exaggerating when I say a pool of this size could breed millions of mosquitoes. So we do get, a handful of abandoned pool complaints every summer or fall. And typically what we require of them at that time is that they drain the water, puncture the pool, or cover the pool. That way it can't build up more water and then breed more mosquitoes. So that's pretty much the main complaint we get as far as vector is concerned. Next slide. I really appreciate you guys having me here to talk tonight. I'm really excited for all that my team is doing. Like I said, I'm very fortunate to work with them, and I think we've got a lot of really great things coming up. I'm excited for the next time I do a unit spotlight so I can share some of the things that have changed and hopefully improved at that time. And I'm happy to answer any questions you might have.
I have a bunch. Go ahead.
Oh, okay. Well, I just have a couple. I was just curious for hoarding, is it specifically hoarding of food waste?
Correct.
Okay, so not hoarding of
Yeah,
books or
if it's
paper. pencils or
dangerous
things.
enough, there are instances where, some of these houses that are hoarding, they're very organized. They save cardboard boxes, cans. They're not food waste. So it's hard for us to get involved. However, sometimes there's bound to be food waste somewhere in there because it is ceiling to floor garbage. Two, I would say that if it's unsafe enough, we can deem it unfit simply because it's not a safe environment. So we are looking for food waste, but depending on the capacity that is present, if it's unsafe, it's unsafe. If it's not fit for human habitation, it is not fit for human habitation.
And that was my other question. What are kind of the typical examples of an unfit dwelling that
Yeah.
would require the health department to get involved? And are there examples that would be unfit dwellings, but it wouldn't be within our purview? It'd be
Yeah, so sometimes we will, I shouldn't say sometimes, very frequently we will work alongside county code enforcement. I can't tell you how frequently we have something and they have something on the same property and we're working in conjunction with one another. I guess what we're looking for is that there is food waste, and a lot of times there is somewhere in that house enough food waste. I am going to be a little grim here and say that very frequently in hoarding houses, you will see dead animals somewhere in the home just because there's so much stuff that it has attracted animals and they've gotten lost in that mess, which also accompanies with animal feces. So typically in hoarding homes, you will find something that meets our code for unfit dwellings, but we are usually looking for one of those things.
What about like mold?
We do not have a mold ordinance. The only time we get involved with a mold complaint is if someone has, it's complicated, but if they have tested the mold, it's identified as toxic mold, that they then took that toxic mold test to their doctor and had an identified respiratory problem. If the doctor can say, yes, there is mold, and yes, it's causing an illness, then we would write an abatement order, but we do not have an ordinance that would legally back us to do anything about mold being present at home. We often provide education on how to remedy the situation, but we just don't have any backing to say that that's needs to be abated. And
Thank
we
you.
get those very frequently. So
Pardon?
we get those very frequently, those
Oh.
calls. Yeah.
Oh, really?
Yeah. But our
About-
team has gotten pretty good about how to point them to what they can do.
Okay, like in situations where you're trying to buy or sell a home or?
No, it's often a tenant who is in a
Oh,
home
okay.
that they,
Of course.
and I will say, not to dive too deep into it, but a lot of older homes don't have a ventilation system in the bathroom. They have a window. And, you know, if it's January and it's 20 degrees and you're taking a shower, you're not like, ooh, let me get my cold window open. But that would be how you ventilate the air out. So some of those things we talk about with them about ways they can prevent and clean the mold that is present. But yeah, it is tricky not having an ordinance.
A couple things. So for the septic, you listed off a whole bunch of questionnaires that people that you'll send questionnaires to. And I wanted to make sure I threw in there builders.
Yes, yes,
Okay.
absolutely.
Okay.
Mhm.
And then, there, for the spraying, for the vector spray, I have bees. So how are we protecting the good insects?
Yes, and so I don't know if you want to talk about that, Leela, but we do have like no spray zones and people can opt out of having it done in their area, but I'll let Leela kind of introduce herself. and
Okay,
talk about
because I know there's some natural alternative things that are safe for bees, but
Yeah,
you tell me.
so there's actually a very small amount that are safe for, like our good bugs, right? Because there's a lot of good bugs. That's something I'm actually really super concerned about because it hasn't really been addressed in our county, which is super sad to me. But, so I do have this, I just found actually today, because I've kind of been piecing together some things. But I found the no spray zones, but I also would like to try to do something to where I can get more feedback on like if there are people that have things, you know, that don't want, because I think it's been like in the past, really discounted people's feelings on the spray situation. I think it's necessary to like protect people, right? When you have a really high virus population in your mosquitoes, you should be doing something for adults, right? But also if we treat our larvae, we don't have to really spray as much is my goal, because larvicide, there's a lot more options. They're a lot less toxic than the spray is, and they're also a lot cheaper. It's really just getting out in the season, getting it done. That way we don't have to spray as large areas is my goal. And so when we do spray, hopefully we're doing it with care, which I think has kind of been lacking. And I'd like to fix. So that answers.
Okay, so I just, there's like neem oil and things,
Yeah, and even neem though, honestly, neem, I use neem in my garden. Neem is also very toxic to bees. So the
Mm.
key with almost every chemical, right, is treat when you don't have your good bugs around. That's huge.
Which is in the dark though.
Yes, it is. It is, unfortunately, but that is now larvicide. On the other hand, a lot of it's like BTI. So it's more like it can't harm other bugs. It has some downsides, right? But very few, and it's the most safe option, I guess, out there. You know, if we're talking about having to kill things, right? It's normally like straight across the board, but BTI does kind of, I don't know, have more benefits, right? Like it doesn't kill the aquatics and it doesn't kill your bees. So that's something I'm looking into doing. It's very time consuming though, I'll say. The sources of water around this county are really abundant. And so it's, as one person, what can I accomplish? But my goal is to get as much as I can, so.
Appreciate it. I just wanted to clarify some of that from previous vector discussions.
Yeah, I'm hoping that you guys will see in a year maybe that we've come a long way from where we were and in an environmentally and human friendly way.
Appreciate it. And then I have a question about the radon tests. So I've been telling all my patients about it, but I had a few that specifically said, I sent my test in and I never heard anything.
Yeah.
And I don't know who to call. And so I wasn't sure what was included in those kits and
Yeah.
actually how many that people, like 811, you said.
We
how many
have
people
heard
turned
that.
this back in?
We have heard that very frequently in the last couple of months. One, I want to say that there's about a 30% return rate. So people who get a kit that actually fill it out and send it to the lab. there's something happening between that and the lab where the lab either isn't receiving them or they're not sending it to us. So we just the other day, Jessica and I had a meeting about what we're going to do. So she's going to contact the lab at the end of this week and kind of tally up how many people need their results, because we have heard this very frequently. And we certainly don't want that to be the case for anybody. And we don't want it to discourage other people from getting a kit. So we are aware and we are on top of that.
Okay, great. And then, that's it. That's it. I had to write them all down to make sure I got them. Got it. Done. Thank you.
So I know you talk about education, which is great. I love all the education pieces that you guys are putting together. So I do want to make a comment about that because I know on the website, there is information about septic. And I actually, especially for first-time home buyers, I direct them to the website just so that they can understand what a septic system is, how it works, the do's and the don'ts, the whole 9 yards. So I appreciate that. So thank you. I don't know who did it, but whoever, did it, it's good, but it's good to have all those pieces
Yeah.
available where, we can direct people.
Well, thank you for doing that. And yeah, I came back from maternity leave in the middle of September and I was like, this is Septic Awareness Month, which is amazing that September is Septic Awareness Month. But we, admittedly, we hadn't done anything during that month. And I feel like next September, our goal is to make it as out there as possible, because before I worked here, I'm still a little unsure about a lot of it. It's a very complicated thing to have underground in your own backyard. So we definitely need to do more, but I'm happy to hear that people have found that helpful. Thank you.
Is part of that, because I haven't looked at that, is part of that, does it break down the new Indiana code to just say this, and this, like this is what you do, like steps, I guess?
I don't know that it breaks down the rule per se as much as it has like pamphlets for homeowners to have an idea of, with an existing septic system, how to best take care of it and what a repair would look like. We can certainly look at having something, maybe a flow chart that would be more helpful, because again, that rule has there's been a lot of confusion around it. And so it would be good for us to clear up some confusion and have that available. So we can certainly look at that.
Okay. Perfect.
All right, well, thank you.
Thank you.
I love your excitement.
Thank you.
All right, so moving on to new business. Item 2545, discussion and vote, appointment of Brianna McCall, interim director of environmental health, to the discussion and vote, job description, director of environmental health.
Hi, thank you. So before you, you have the updated version of the Director of Environmental Health. I know the hour's late, so I'll keep this very short. In summary, what we did was we wanted to build a more accurate description. In this particular case, the role was very old. It hadn't been updated in approximately 10 years. So the role had changed a lot. So we added necessary descriptors, made it current. We also use an eye towards making standardized language that will flow from director to director, director to assistant director roles, and then across the different units and into the department as a whole. So in future months, as we bring you other job descriptions, you should see some common themes that have evolved out of the first two that we're presenting to you tonight.
Any discussion? Okay, I'll entertain a motion.
I will move to approve the new job description for Director of Environmental Health.
Second.
Okay, all in favor, say aye.
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 All opposed, say nay. All right, motion passes. Item 2547, discussion and vote job description, Assistant Director of Environmental Health.
Ditto.
Okay.
It's the same thing.
All right, any discussion on that?
I will move that we approve the job description as presented for the Assistant Director of Environmental Health.
Second.
All in favor, say aye.
Aye.
Opposed, nay. Okay, motion passes. Next item, grant requests, none. And then old business, discussion and vote billing consultant proposal as tabled.
Okay. We would like to request reopening of this item.
Do you want to explain a little bit about it?
Oh,
Or
absolutely.
do you need to
We need to make a motion.
open it or just discuss it? You want to explain it?
Absolutely. So this proposal that we're asking you to approve is to allow us to use the services of a billing consultant who specializes in medical billing to help us restart our billing program through the department. Currently, all of our billing is happening through our VaxCare partners, and that is strictly immunization billing. So that does take care of the majority of our billing needs, but there are some times when we're essentially losing some revenue by not being able to bill straight out of the office. The other area where we would be losing is other services. So for example, we're interested in exploring the CHW program and discovering there are some allowable billing that we could bill Medicaid for, but currently we aren't. So that's money left on the table. So by engaging with the specialist, they'll be able to come in and teach us the ropes, the process. We really have a lack of institutional knowledge within the department. There's a few of us that have some familiarity with it to various degrees, but in terms of actually doing the process, monitoring the process, making sure that we're on top of it, doing it correctly and meeting all compliance, we just lack that knowledge. And this person will help us with that. Their proposal is that they estimate needing approximately 5 to 8 hours, and they bill at $100 an hour in 15-minute increments. And the goal would be to accomplish this training. We would like to start the training with her after January 1st, with the goal of having the billing of starting as soon as possible after that.
So I think we've talked about this before, but that is like a huge complicated degree all in itself. And from what I understand, you guys want to spend a couple hours teaching our billing staff how to do that very complicated degree. Is that correct?
Well, the billing staff will be me to begin with. So it will be centralized with one person. And something that I have talked with the consultant about is actually our billing should be actually very, very streamlined. We're only billing a very small subset of codes. And so it really narrows down the responsibility that we have. That said, we do want to do that properly because of course there's risk associated with doing any billing. So it's vital that we do it accurately, on time, and if whatever issues are, we're resolving any issues in real time.
So will she be providing, does this include any kind of ongoing question availability?
Yes, and that's part of the 5 to 8 hours. So the estimate is that she'll need a couple of hours to prepare the materials that she'll work with us on. It'll be approximately an hour and a half to 2 hours of actual either virtual or in-person time. And that also allows for some consultation after the fact so that she can check our progress, do some spot checks for us. And then also if we do run into trouble or we have unanticipated issues, that she'll have that, the ability to come back in and spend that time with us so that we can make sure to do it well going forward.
So she's gonna develop procedural codes of the common things that we do and the typical ICD-10 codes for those procedures. Okay.
So you keep saying us, but are you really referring to just you, or is someone else going to be in this training with you?
At the beginning of it, this will be primarily myself
Okay.
doing this. We'll see how that goes. And if we do have a plan to eventually bring other staff into it, but we feel like for the time being, it's important to get it started. And it's probably easiest to do with one person who has some familiarity with the process. And then as we hit our stride, we'll start branching that out.
But out of curiosity, is it the same whether there's 3 people in the room or 1? It's going to cost the same,
Right.
Correct,
correct?
correct.
And to be honest, we're trying to cross-train just about everybody in the department. And so
Okay.
we want to have a bench at least 2 deep in anything. So if somebody's out unexpectedly, illness, some sort of emergency, that we have someone else who knows how to do that job. It may not be their primary job, but they know how to function in that position so that we always have some sort of internal backup.
So that was my only concern is rather than having one person listen, maybe it would be more beneficial for us to have more than one person in that training, especially if it's not going to cost anymore.
Sure.
So
Sure.
just a suggestion.
And the other thing that he didn't mention was that he also has is it 12 to 15 hours of online before he meets with her using our medical software for the billing component. So he's going to be training online tutorials, self-tutorials.
Now, does the online training cost us anything, or is that built into the current program that we have?
It's built into our monthly fee.
Okay, okay.
Yeah, it's a self-guided training.
Uh-huh.
They have like module paths that you can it's self-instructional.
And my understanding, because I had asked you about this earlier, is that this is this would be paid for out of a pre-existing fund, correct? Or
So we already have the electronic medical record Athena,
Mhm.
and all we're doing is utilizing capabilities that it already has without paying extra for those capabilities. These were just untapped capabilities that we were not using. So Athena has already been used in our immunization practice to document and, treat our patients that come into the clinic.
But then for this training, the specific training with this
Billing,
billing specialist, that we would pay her, is that coming out of? other
out of our
contractual
training fund,
service?
yes.
Okay, out of that, is it the county health department fund? Or,
Amy, are you sitting back there?
I think she thought she'd get away with that being called.
Actually, what we would use would be the HFI funding. We do have some contractual funds available that we put in that we don't have earmarked for anything particular. So the $800 would be
Other contractual services?
correct in Fund 1161, the local public health services.
Local public health services, yes, the
Mhm.
3,000 series, 3170, 31,070, other contractual services.
You're looking at the 2025 budget.
Oh,
It's going to be in
that's right.
2026. It has a different account number. It's just going to be called contractual, not other contractual. So I believe that's number
But it's
36015.
the
Yeah.
2026 version of this same little
Right.
subset. Okay,
Correct, correct.
okay.
Is part of her training involve any analysis of what we do and where we are missing charges, like incident to billing? And because I assume that all goes under your license, correct?
Yeah, she actually wanted to get some reporting that she's already looked at to see what insurances we are using or billing and or potentially billing. And a lot of this is really just secondary insurance. That's what we're trying to capture, the secondary insurance. Right now, the VaxCare only bills one insurance. And so if you have a primary and a secondary, this will pick up any of the secondary. But the primary insurance is the only thing that VaxCare will cover.
Okay, yeah, because I'm sure, we've talked about this before, but it's like there's tons and tons and tons of money on the table that I hope.
We
I
need
assume
to,
she's gonna evaluate that.
yeah.
Good.
She does this on a national basis. She travels all the time going to, recently she was in Austin, Texas, getting a clinic set up with their billing. So she's very well known and very well respected.
So billing and coding changes every year too. She probably told you that. So that's something that's gonna have to be ongoing in our budget for an update of the code changes and
Right.
FYI for budget fun stuff. So, okay, good luck.
Thank you.
All right, I'll entertain a motion to pass item 2540.
So moved.
Second.
All in favor, say aye.
Aye.
Opposed, say nay. Okay, motion passes. Good luck. You'll need lots of coffee probably.
I will. Thank you.
All right, and then lastly, public comment. Anybody signed up? All right, very good. Well, then, time and place next meeting is December 17th here at 4:30. Hope everyone has a happy and safe Thanksgiving.
Thank you.
Thank you.
Thank you.